Welcome to the Rehab Roundup. I'm your host, Dr. Hassan, board certified physiatrist and independent practice owner, helping physiatrists build independent practices so that they can achieve financial independence and live without limits. Welcome back to the Rehab Roundup, broadcasting from Arizona. I just wanted to say welcome back to those of you all who are with us again. Especially from last week when we were in San Diego attending the AMRPA conference. We're back in Arizona, and today I want to talk to you about leveraging the research. What I find is that, again, like everyone here knows, a lot of people don't necessarily know what we do as a specialty. So I think as an added value, and to educate the specialists and anyone else who's kind of taking a look at the medical record, it's important to leverage the research that they have out there to justify what we do and bringing our patients to our particular level of care. I think it was back in 2016, the American Heart Association and American Stroke Association produced a paper that basically said that stroke patients would benefit from transitioning to acute rehab level of care, above all post-acute areas. And I think that's important to add that to your documentation so that, one, you educate the other specialists, other care providers, case managers, so forth and so on, who are taking a look at your documentation, as well as the medical directors of the commercial plans who are determining whether or not they want to approve this level of care for that particular patient. I know a couple years back, may not necessarily be the case now. I think it was really in vogue to talk about evidence-based medicine. Well, that paper that the American Heart Association and American Stroke Association produced was evidence-based medicine. Took into account a lot of different factors, a lot of research that did justify why patients benefit and have better outcomes after strokes when they do go to acute rehab level of care. So I think that's going to be an added value, and that kind of separates us from other specialties. It achieves the goal of educating any and everyone who's going to take a look at that medical record. And also, if someone's really curious, what they can do is actually take that reference, look it up, find the article, and read it for themselves. So there's also papers out there regarding justifying or explaining why it's appropriate and best practice to transition multi-trauma patients to acute rehab level of care as well. So I think adding that to some of the tools that you have in your tool belt when you're going out into the acute care hospital, seeing patients and making recommendations and talking to the therapy team within the hospital, the case managers, the other specialists, and the internal medicine doctors, I think is good practice, and it kind of explains exactly why we're making this recommendation. So leverage the research. It's important. Added value, helps you advocate for the patients and get the right patients to the right level of care. I am Dr. Hassan, independent board certified physiatrist and independent practice owner, helping physiatrists build profitable practices so that they can achieve financial independence and live without limits. Thank you for tuning in to the Rehab Roundup. You can follow me on social media at Dr. Hassan Rehab, DrHassan Rehab. Thank you, and tune in next week.